Welcome back. Today, no question is a stupid question. We recently received an email with a question from Jacqueline in Winston-Salem, North Carolina, who writes, I know someone that has keratosis on the back of their arms, but I think I may actually have them on my butt. Is that possible?
Oh, interesting. Well, first off, what is keratosis? There's different types of keratosis. Something we see in kids a lot and adults is something called keratosis pilaris. And I'm going to show you a picture of it. And there's a little bump. Sometimes they're fleshy colors, sometimes a little bit red, 1 to 2 millimeters. It almost kind of has the gritty sandpaper look, and oftentimes is on the back of their arms. That's where I probably see it the most, back of their arms, probably because that's where it's exposed.
And like you said, different types. And keratosis, what does that mean? It just means that there's a buildup of that keratin layer, that outer layer of the skin. In my practice as a plastic surgeon, typically I see senile keratosis, really are age spots that are raised. Also see actinic keratosis, which is just a keratosis in response to sun exposure. And finally, a seborrheic keratosis, which is more raised, darker color, almost a spongy-like feeling to it. But they're all different types of keratosis. A benign lesion, really the biggest thing is that cosmetically people don't like it.
So let's talk about the buttocks then.
Yeah.
Is that, because obviously you're not going to get, most people don't have a lot of sun exposure
Sun exposure, right. And one thing, anybody, if she's asking about this on her buttocks, it might not be keratosis at all. It might be acne. That's probably what I would think it would be more likely to be acne. Buttony, yeah.
We call it buttony.
But what to do about it? Anytime I see keratosis on the arms, I suggest, you might have some sort of food allergy, dairy, something like that, and maybe cut that out.
If it isn't that, if it is an allergic process, probably just an inflammatory process. If it's not acne, if it is acne, treat it like acne on your face. So you'd want to use benzoyl peroxide, salicylic acid, topical cliomycin, something like that. Make sure gently exfoliate. Otherwise, if it's a more inflammatory thing, you'd want to use a topical steroid.
I think a lot of people on the back of their arms will try to scrub it to exfoliate it, and that can, that can irritate it more. Probably my favorite treatment is the salicylic acid creams because it's very gentle, kind of helps remove that buildup.
Yeah, because there's really no way to prevent them 100%.
Right.
For the bigger ones that I see in my practice, we either shave them off, cauterize them off. Some respond to laser.
And one of the ways you can tell the difference, when you look at that picture, you can see how someone could get acne confused. But keratosis, it's hard.
Yeah,
the keratin, it's a hard substance.
You're not going to
whereas a pimple,
squeeze those and get
a whitehead
pus
is soft, right? So and you shouldn't be squeezing out, like you said, the keratosis shouldn't be able to squeeze out pus, et cetera. So, because the treatment's very different. And then last but not least, if it's on your buttocks, you're not sure what's going on. I think no question is stupid. Nothing's too embarrassing. If you can't figure it out, have a doc look at it.
Get the diagnosis. That's always the first thing you need to do.
Gentlemen, it's been a pleasure.